Well, we're going to the Accra Digital Center. The good thing about it is that our team is ready. The JoyBusiness team, they're partnering for health. And we're bringing to you the JoyBusiness Health and Wellness Trade Show. It's a one-stop platform from today to the 26th of May in which everybody, anybody, any organization can go to the Accra Digital Center, get access to great presentations and informations on improving many things around our health, the National Health Insurance Scheme, getting access to research and data, leveraging on technology to make sure that we improve the quality of healthcare that we get as a people. And that's a good thing about it. And so one of the great minds leading the whole team there and the coverage and as part of the team also putting this together is Odilia Ntiamwa. And Odilia is live from the Accra Digital Center. Good morning to you, Odilia. Well, so Odilia is ready. Let's go over to the Accra Digital Center.
Sort of investment when it comes to health research. How much investment, for example, is the government of Ghana putting in at Noguchi?
When I joined Noguchi in 1994, and then I was fully employed in 1996, that time government was giving Noguchi some money for research. But with time, the money stopped coming. And researchers have to look for their own funding in order to do research. So if you want to do research now, you need to write a proposal, send it out. If it's able to attract funding, then yes, you can do the funding. Other than that, government is not bringing anything now for research. All we get is our salary.
How frustrating is that when you perhaps think you have a brilliant proposal that is made up of some good research that will really affect the public health of the whole country, and then you seem not to be able to get the needed or the required amounts to put into research? How frustrating is that?
I would say it is very frustrating in that research itself allows you to think and then be able to solve problems. So if we don't train our students to think, or maybe research said don't think, it becomes very difficult for the country to be able to come up with something. So I think researchers have to be supported, especially institutions that are doing research. Government has to support this in order for them to think, to be able to solve problems. There are always questions out there. People are asking a lot of questions. Things are happening. And without research, it will be difficult for you to come out with exactly what is happening.
Dr. Odum, I'll come to you very soon, but I want us to put this in proper perspective. Tell us, give us a general idea, because the ordinary person, and of course, even some investors don't really know what happens at Noguchi. Tell us exactly the sort of research that you have done, some of the breakthrough findings that you have come up with that has really affected public health in this country, and why we need to pay attention.
Well, to start with, let me talk about polio immunization. You know, when polio vaccination started in this country, you need to look at the number of doses that have to be given to children in order to protect them. And I must say that this research work was done with Noguchi. We're able to come out with very good findings that is in use up to now. The number of doses of OPV that has to be given to children in order to protect them from getting polio. So that research was done in Ghana, and up to now, the finding is what we are using to immunize our children in the country. And it has been very helpful, very helpful. Other countries have also done, and they have their own results. Apart from that, if you look at measles, for instance, the vaccine that is administered now is given at age 9 months. Over the years, when measles was very endemic, and children were dying of measles, Noguchi also conducted another research into the vaccine, not the one that is currently in use, but another vaccine, in order to reduce the age, let's say about 6 months, then you administer the vaccine in order to protect the children, because we realize that before the children attained the age of 9 months, some of them had already contracted the disease, some have died, etc. So we're looking for a potent vaccine that could protect the children before they get to that age of 9 months. We worked on one vaccine from Japan, known as IC measles vaccine. It was very potent. If you look at the immunogenicity, when it's given to children, the seroconversion and the protection limit, it was as good as the one administered at 9 months. And so the conclusion was that this particular vaccine is also good and can be given to children at 6 months before they reach 9 months, where most of them will get the disease and even some die. A similar work was done elsewhere, but unfortunately, the vaccine was not accepted in the country, and we are still using the 9-month ones. But there has been a lot of improvement, and now you can talk about measles, but for several years now, about 11 years, Ghana has not recorded death, children dying of measles, which is also good.
I'm very much interested in the vaccine that is currently being administered for children, also a development from Noguchi to really deal with the issues of diarrhea. If you could just...
Yeah, that's the rotavirus vaccine. That was also introduced a few years ago. You know, a lot of children were getting rotavirus, and there had to be an intervention. Ghana Health Service chose this particular vaccine. There are two types. They chose this particular one because it was very effective and it protects children as well. Ever since we started using, records shows that incidence of rotavirus cases has gone down.
Yes, I'm about 40%.
Down, exactly. And most of our children are not getting the disease, meaning that the vaccine is good, it's protected them, and we need to continue to use it because there are a lot of benefits.
What I gather from the department that came up with this is that pretty soon the sponsors are going to pull out and government will have to put their own money into the manufacturing of the virus to continue for the children. How does it look like? Is this sounding like something the government is going to do or not? Or you will still go around looking for funding in order to protect our children?
If you look at our immunization program in the country as a whole, it has always been sponsored by either UNICEF, Gavi, etc. And there's a program ongoing now that Gavi is gradually withdrawing, and government has to come in. So if you remember, somewhere last year, there was shortage of even polio vaccine, and immunization has to stop for a while, but government was able to intervene. Money was released and they were able to procure more vaccines. Yes, donors are withdrawing gradually and they expect governments to come in strongly to provide money to purchase vaccines to protect their children. It's not only rotavirus. It's happening in polio, it's happening elsewhere. If you take measles, yellow fever, for instance, work in this area has gone down because support is not coming. So we need government to intervene because all these donors, gradually they will withdraw. You know, donors bring money for research and for this thing because they also get something out of it.
Absolutely.
At a point when they realize they've gotten whatever they wanted, gradually they will withdraw. And if the government is not there to come in, then it becomes a problem. At the moment, we have gap in these areas and it has to be addressed.
Okay, so let's do some technology. Is the situation in research virtually the same as what's happening in tech, in the tech space? How much of tech have we introduced into medicine if you look at the Ghanaian environment?
Okay, thank you very much for the question. There's currently most doctors and healthcare facilities are located within the Greater Accra region and the Ashanti region. So there's 8 regions that are severely underrepresented in the healthcare industry. So that's where we come in. I work with Soft Edge. We've developed an app called Save Doctor. It's a telemedicine app that will allow anyone in Ghana access to a physician anytime that they want. So the app is, it has been developed to be affordable convenient, and confidential. So anywhere you are in the country, you'll be able to access a doctor. And this is we are trying to bridge the gap, you know, between where the medical doctors are and where they are in short supply.
Now, tell me, these are medical doctors that are pretty busy already, and so how are they going to still make time to serve the underserved, which form about 80% of the population?
Okay, thank you. Yes. So we have doctors now on standby. That is their job. They'll be on the platform. But in the near future, we'll be recruiting more doctors onto the platform. And this is good because you'd have access to general practitioners, and you'd have, even more important, you'd have access to specialists. Imagine someone living in Bolgatanga. I can guess how many psychiatrists or even internal medicine physicians are over there.
That's right.
You know, suddenly this person has access to a physician specialist, to a psychiatrist, to a urologist. You can name them.
But that's if they have access to internet and their phone works well. So yours is still very dependent on the Ministry of Communications delivery, and then the telcos delivery of good internet access.
Yes. But we have to remember that, like, at present, I think we have over 120% penetration of smartphones in Ghana. So that means some people have more than 2 smartphones.
That's right.
If you go to the villages, people have smartphones. Even in Greater Accra region here, not even in central Accra, but in the peripheries where they are not so well developed, you see people with smartphones. They know how to access the smartphones. They know how to access the apps. So this would be a perfect opportunity to give health delivery in those places. And the app has been designed to be very user-friendly. So as soon as you log on, you create a small, short account, you know, just the usual biometrics, name, age, blood group, etc. You have access to the doctors. Not only access to doctors, but you also have access to health information. There's health information built into the app. There's first aid information built into the app. So let's say you are somewhere in Tamale or something, you have a smartphone, and God forbid you are bitten by a dog. You know, right then you take out your phone, you get access to a doctor. Doctor, please, what do I do? And right then you do A, B, C, D. Okay, even that instant access to a medical person has tremendous impact to that person. He's not panicking anymore, so even if there's
but
venom
isn't that going to push people to self-medicate?
No, it won't push people to self-medicate, because within the app, we've liaised with pharmacies and with labs. Okay, so if you need any medication, let's say you have hypertension, you need a regular refill, you can log on to the app, you talk to the doctor, my medication is almost running out, and as you know, with hypertension, you need to continuously take your medication. And right there, he can send a prescription to a pharmacy of your choice, a pharmacy to your convenience, and you can pick it up there right away.
Doctor, you can just see that he is in the private sector, a medical doctor, now really concentrating on apps and thinking that this is the way to go. Can you tell us how private sector, apart from international sources, have been really interested in research in this country? Or it's usually research just sitting there that people don't really know about?
Well, like you said, a lot of people may not know about research. And some have heard about research, but it doesn't make any meaning to them. Some private sectors, Yes, like the industries, etc. Looking at whatever they do, and then what the researcher is also doing. Is there any link? Can the researcher answer their questions? These are some of the things. So not long ago, even the universities had talked about incorporating this to the syllabus so that before somebody comes out of the university, the person will somehow be prepared to meet the needs of some of these industries. And the industries also have to contact the universities as well as the researchers for them to know what they are doing and see how they can also fit into their programs. Few private sectors, yes, they do contact the research centers, especially individuals who maybe claim they have some products and they want to sell. Sometimes they want some research to be done on these things to really be sure whether whatever they have is potent against some viruses or maybe germs before they go on the market. So yes, a few of them have research ideas, they contact researchers, but mostly it has been international, and they have been bringing this funding.
Why is it like that? Why aren't we interested in you? Is it because you haven't really given us a course to? You haven't really given us access? Why aren't our businessmen, people with the cash, interested in coming to you for your research work to expand into drugs or into products that we could use for public health care?
Maybe two things. Either they don't have any question to be answered, or they do, but sometimes they have to look at the whole thing holistically. For outsiders, for instance, they always have questions to be answered. So they get their money, they have their question, they want somebody to solve for them. And so if they're able to identify you as somebody who has the potential to solve their problem, they come to you. So I'm thinking locally too, if they have the questions and they're able to.
Well, so we brought you that conversation by Odilia and Tiamwa, and of course it's at the grounds, the Accra Digital Center, where we're having the Joy Business Health and Wellness Trade Show, which is taking place from today to the 26th of May 2018. Please make sure that you check on all our regular social media platforms, JoyNews on TV. We also have Twitter handle at JoyNews on TV and our regular channel on YouTube, My Joy Online TV. But it's always on JoyNews that you can get the best, and from that trade show, which is already started, as we're bringing you all those previews before the launch in itself,